All right. Thank you so much for coming to CARI's presentation 2023. And my name is Dr. Ann Wade, and in a minute we'll have our presenter. I want to thank our committee for working so hard to bring us our presenters. And so this is one in a series of presentations that we will be having for the Center for our Research here at Charisma University. So I want to thank Dr. John Wallert, Dr. Deontay Jimerson, Dr. Veronica Butera, Dr. Anita Abbott, and Dr. Sherry Chukwuka for their hard work in getting our presenter. And today we have a very interesting presentation that Dr. Sengupta is going to be doing, and I'm going to let him take it away and introduce himself. So thank you so much for being here, and I'm going to give it over to you.
Thank you very much, Dr. Ann. That is very kind of you to give an opportunity, and I really thank the university and the CARI team for giving me this opportunity to present my research. I hope this will evoke some interest. And but before I start talking about my research, I'm Devashish. I've been in academics for now close to 23 years. This is my 23 year in academics. And I work with an university in the Gulf region, and I've been working before that in India. And I've also worked in industry, and even during my academic stint, I worked very closely with industry and been in advisory roles for companies in India, in the Middle East, and in UK. As far as my research area goes, it intersects three areas. The first of that is social psychology, which is basically understanding behaviors. So that is the first area. The second area is generational research. So understanding behavior of newer, younger generations. Primarily, my focus at this moment is on millennials and Generation Z. And third is in terms of engagement. So in other words, if I put all these three together, it is my research focuses on understanding the behaviors of younger generation to explore their engagement in various contexts, whether it is an employee context, in organizations, or in the market context as customers, in the social context as volunteers or students, or in the entrepreneurial context. So in various contexts. So that's what my research really focuses on. As far as my current research is concerned, this research is focused on the young women in Bahrain. So these are primarily the millennial women in Bahrain. And the research is focused on them. Right. So let me share my screen. I think that will make the things more easier. Allow me a minute to share my screen. Is it visible now? Can you see my screen, Dr.
Yes.
Ann? Is it
Yes.
visible?
Yes. It is. Thank you. It is.
Okay, then I'll put this on full screen. And so I have about 30 minutes and I'll try to limit my time to that. And as I said, my focus will be on female leadership in Bahrain during COVID-19. Now, specifically, my research focus on the motivation of young women volunteers during COVID-19. Qualitative Inquiry in Bahrain. This is my title of the published research. It was published in Administrative Science, which is a Scopus Syntax Q2 ranked journal, an open access journal. And along with me, I had one more co-author, Sheikh Hadawa Al Khalifa, who is also my colleague and works in Bahrain. She's from Bahrain. She's primarily hails from Bahrain. So this research, as I said, focused on the young women volunteers in Bahrain. So let me talk about this the research. Now, in terms of the significance of this research, why is this research important? Because this, if you look at this part of the world, this part of the world, the role of women has been not as much studied as maybe in the part of the world that you come from, right? So hence this kind of also showcases how and what kind of role women are playing in this part of the world. So that's first significance. The second is that I think this research, which was to look at what motivated the young women to volunteer during COVID-19, is significant also from the perspective that this was a moment of crisis that the world faced. It was not only a moment of crisis, actually, it was a long moment of crisis, and it stretched for more than 2 years. And obviously, I think we can probably say that we are out of COVID. But yes, there are strains which remain, and there are some minor concerns which remain here and there. But uh, but that was the time, when we were all scurrying for the safe confines of our home. And what at that time when the home felt safest, and to be inside your homes with your own people felt safest, what would have motivated these young women to actually go out, put themselves at risk? Most of these young women have young children, they have infants, they have kids, they have old parents to take care of. So what would really motivate them to put themselves at risk at this moment when everybody was doing the contrary to what they did? So I think from all those perspectives, this research held significance for us, and I hope it held significance for others as well. What was the trigger? The trigger of this research was an interaction that started in the classroom. We are all academics, so we know that sometimes the classroom discussion can really become an idea or a fuel for our research. And this is exactly what happened when I was teaching a course on change management, managing change. And um, I encourage all my students to actually freely share. And one of the questions that I asked them it was one of the introductory classes, and I was asking them to talk about any change that they had experienced and how it had impacted them, how it influenced them. And out of all my students, there was one student, and I teach in a university with a very good mix. So there was a female student who actually shared her experience with about volunteering during this period. And her story was fascinating in terms of the kind of sacrifices that she had made, what really motivated her, how she actually did the volunteering work, and what kind of experiences she underwent, how it changed her as a person. When I listened to her story, obviously that was the class. I really appreciated her, but I really tell you, I swear by, that I didn't that story never left me. And even after the class, I kept thinking about the story, and I understood that there this could not be the story of that girl, of that young woman. It is a story of all those young women who volunteered during that period, during that time. So it was very intriguing, and I thought that I think it is important that this thing is captured. And I think that is from the point that was the trigger for me to do this research. Why I selected Bahrain for this study, or what is in terms of what we call as the context of the research or the background of the research. Why is this context so important? So I think there are three aspects to the context which made this context very interesting and also very compelling for me to do this study. The first of this context was the Bahrain context. Now, if you look at the context of Bahrain, Bahrain has done exceedingly well in terms of how it actually dealt with the pandemic. Now, there is an evidence for it. Bahrain is a very small country. It is a country of just about 1.7 million people, and it's a small island, and it's one of the world's smallest countries that you can find. However, there is something called as NICI COVID-19 Recovery Index, which is a global index which measures how different countries have done in terms of containing the pandemic. And it has three metrics that it used. One is in terms of infection management, second is mobility, and third was vaccine rollout. In November 21, out of the survey of a study of 121 nations, Bahrain actually stood first among these nations, which is not a small achievement considering that the size of this country is a very small country. And obviously, the small country also means that it has limited infrastructure, limited resources. So that was one. And there are more powerful countries than this, even in this region. So Bahrain, having achieved this, was as a definitely very significant. Number one. Number two, what makes this context very interesting is the women in Bahrain. Women constitute 49.4% of the population. But not only that, you will be surprised to listen to that because it's a Gulf region, and most of the times we think that maybe these are the countries where the women participation in the workforce is very low. Not in this country. In this country, the 49% of the workforce is composed of women. So women are playing a very significant role in this country's development and country's progress, which also makes it a very compelling context to study. And third context is a more generic context, which is the youth context or the generational context or the millennial and Gen Z context, which if you look at multiple researches, there is enough and more research evidence to suggest that these generations, the younger generations, have much more social inclination, or what do we call that? They're much more social minded, socially responsible than maybe all the previous generation as a cohort, not as individual. Obviously, individual differences will remain, but cohort as a cohort. So all these three made us made this context very interesting and compelling, and that's for the reason. If you see that we studied we in this research, we have covered Bahrain, we have covered women, and we have covered young women, which all takes care of all these three things that I mentioned in the context. The method that was used in this research was qualitative. We used a qualitative narrative inquiry, and we used thematic analysis. We used focus group and in-depth interviews. We conducted focus groups first, and then with those indicators, we conducted in-depth interviews. Um, and the interviews were conducted with young women volunteers who had volunteered during the COVID-19 crisis, whether during the RT-PCR test drives or later during the vaccine rollout. And one of the reasons that I started this research, but midway I involved my co-researcher, the Sheikh Adwal Khalifa, who comes from Bahrain. The reason was obviously cultural, because having somebody from Bahrain was very important to really understand the mindset, and hence it added to the analysis. But before that, we also had a lot of help in finding volunteers, because women volunteers, some of them are shy to speak to male researchers, and some of them are not very proficient in English. So we had also to do certain interviews in Arabic so that we could really get a rounded view of what motivated them to volunteer during this period. We also interviewed some male volunteers because we wanted to do a little bit of comparison. Was there a difference between the volunteering motivations between women and men during this crisis? Now, what was our finding? Motivation. We point, in terms of our finding, we found six motivations, or the six motivators behind volunteering during crisis, and when we one of the motivations was the call for homeland. So the love for the nation and standing by the nation at a time when it faced a crisis was a big driver for volunteering during this period for these young women. Some of these quotes I know I have put on the slide because they were so interesting, and this is not only the quote; their stories were so fascinating. Look at these quotes, and I quote them. I felt my country was weak at this time, and it needed me at this hour of crisis. Something ominous was destroying my nation, and I had to be there for my country to save it. Right? I stayed away, and my old parents, extended family members, for close to 9 months while I had taken up volunteering work. Imagine the kind of personal sacrifices they made. This volunteer, whom we actually interviewed, she did not meet her parents for 9 months because her parents were old, and she feared that if she contracted the infection during this volunteering, they were taking all the safety precautions, but still there is a probability that she might contract infection. And because of that, she didn't want to meet her old parents, because if you remember during the first version, the older people were at the maximum risk, right? And even with her, she took risk in terms of she had young children. She stayed with her husband and young children, but it was tough to stay away from the loved ones. But they did, as I said, all this for the love of the nation, which is again a very fascinating motivator. Another motivation that we found for this young women volunteering was serving humanity and philanthropy. The love for the society, or love for people, or love for that service to people, right? Service to humanity, serving humanity at a time when it faced a kind of debilitating crisis. I was witnessing a tremor in the world that was altering the course of all our lives. I heard every day news of wide-scale suffering and rising death toll. Something inside me changed, and I felt that I needed to do something for the sake of humanity. I could no longer watch the scared faces and helpless eyes. Scared faces and helpless eyes. It's very interesting how they have described what really pulled them towards this volunteering. And some of them had faced opposition from their parents initially, or even from their family members, but they persisted. They convinced them, and finally they were, not only convinced. Later they were, as volunteers told me, that they were very proud that they had actually gone ahead and volunteered during that time. So this was one of the motivators. Uh, some of the volunteers also told that religion and religious values were a motivation behind them volunteering. Though my religion has taught me that my life would remain incomplete if I do commit myself in some way to the service of humanity. Charitable volunteering, I believe, has its reward that will help in shielding harm from the virus as much as possible. I trust God is the preserver. So definitely an influence of religion and the values taught in the religion in volunteering during this period. Another motivation, which is very unique to women that we found, was that they wanted to contribute as women. They wanted to be contribute to serving the country at a time when it needed most, not in some bitter way, but in a very positive way, right? So there was one of these volunteers who said that her brother was a doctor. If you see the first quote, and she saw him doing 18-hour shifts every day without getting tired or lazy, and even sometimes when he came back, he actually wanted he stayed in the car. He didn't actually come inside the home because he was staying for about 18 hours with corona patients, and he feared that he might infect his family. So when she saw him doing such hard work and so much of sacrifice, so much of struggle, she said that I also wanted to do something like my brother. As I said, again, not in some bitter way, but in a very nice way, in a very positive way, to say, okay, as shoulder to shoulder, as women, we will also contribute to this cause. Uh, the fifth motivator that we found was in terms of the personal loss and suffering. Many of them actually suffered. Their family members suffered. They suffered personal losses. There was one of these volunteers who lost both her grandparents in a span of 20 days, and or some of them saw their family members losing their near and dear ones, or the suffering of their family members, and all this made them feel very weak, helpless. And the only way to feel empowered again, to feel strong again, was to fight it, not to sit at home, not to get scared, and not to hide at home, because that would mentally destroy them. That was kind of a it would really mentally impact them or affect them very much. So many of them actually decided that the only way to fight this, only way to actually somehow redeem this loss and suffering, was to by alleviating the loss and suffering of others, right? So by doing that, they felt a personal sense of that vacuum that they felt inside because of this loss and suffering. Somehow felt like it was filling up because of them serving the society and serving the others who were in suffering. And finally, the sixth motivator that we found was a sense of self-actualization. And some of them said that they wanted to do something that they can be proud of, something that their kids and later their grandkids could be proud of, when they say that, okay, that's something that inspires the future generations. So that is also one of the motivators. However, very interestingly, when we look at these six motivators, we found that these we when we looked at compared our findings with the literature, and we looked at the various literatures, when we compared our finding, we understood that these motivators were not really all of those. What they had something similar, but they had also something different. So as far as the discussion for our finding goes, we compared that to the existing literature, and we found that these motivators could actually be categorized into two primary categories. One was the normative category. So all these normative is what society expects you to do. So how society would expect you to behave at a time when it was facing a crisis. So if you see the call of the homeland, or the philanthropic zeal, or the religious values motivators, or their desire to do something as a woman, contribute something as a woman, all fell under the normative motivators. Whereas the other two motivators, that is, volunteering to mitigate the personal loss and suffering, volunteering for self-actualization, actually fell into personal motivators. So this is one thing we could actually discuss about our findings in terms of how we could actually categorize these motivators that we found out during this study into normative and personal motivators of volunteering. Also, interestingly, in this case, if you look at, as I told you, we studied a small sample of male volunteers as well, and we found that all these motivators, except women as a contributor, were similar to male. The men also had the similar motivations, except that women as contributors, because it was very specific, gender specific. And instead of that, they had a utilitarian motivation also, which means some of them also did it because they thought that it would later help them to find a job, or find a, good, do good to their career. So that was the only difference between male and female motivations for volunteering during COVID-19 crisis. As I told you, I already told you about how it was different for men. The role of culture, we used literature on Hofstede cultural dimensions. As you know, there are six cultural dimensions, and we looked at how the culture did the culture play any role in shaping these motivators, and we found yes, culture actually played a big role in shaping these motivators. As you know, Bahrain is a Islamic collectivist society, and it had a strong influence on shaping this volunteering motivation. If you see, one of the influence that you can see immediately is in terms of how we could actually, what was our finding. If you see, out of the six motivators, four fell in the normative category, which basically normative means how society expects you to behave. So this was more, it's an evidence of collectivist society. Collectivist societies always do something for the community, right? They work together so that they can actually help the community. So helping the community, reaching out to the community, doing service to the community, normative is an evidence that the culture of the collectivist culture that Bahrain had played a big role in shaping these motivators. But as I said, it's not only a collectivist society, it's an Islamic collectivist society. And how does the religion and culture combine here? Like, we found an evidence of something called as Ummah. You can see Ummah. What is Ummah? It's a very unique concept related to this region. Ummah is basically a concept here which says that the community is like a body. And if any part of the body is in pain, then the entire body is in a state of suffering. Similar to that, if any part of the community is in pain, then the entire community is in a state of suffering. And hence the community then gears up, then joins together, hands together, so that they can help those part of the community who are in pain, alleviate their pain, so that the entire community suffering can be alleviated. So this is very interesting that for us to see that how culture actually played a role in shaping these motivators. Um, Finally, in terms of how this volunteering experience influenced these volunteers, it kind of, I think, did three things to them. Uh, the first two things can be categorized as personal growth. So I think personal growth can be seen as growth in them as in terms of how they grew as persons, right? So growth as a person and growth in terms of skills. So growth as a person, many of them said that this experience changed them. Like for instance, one of the volunteers told that she was a very temperamental, impatient person, but when she went there, it was a part of the training, and they were told that there were people who come for this RT-PCR test, especially during the test. They will come. Maybe some of them will not speak very politely to you. Maybe some of them will scream because they are waiting for a long time. But you are not supposed to react. You're not supposed to lose your patience or temper, because you have to understand. You have to empathize that many of them, maybe some of them had a death in the family. Some of them have lost somebody near and dear. Some of them are anxious because they are fearing that they have contracted the infection. Some of their family members may be in hospital, maybe in the ICU. So you have to empathize with them. And because of this, she says that I have changed as a person. Now I'm much more patient. I'm much more calm after this experience. So many of them had a personal transformational kind of experience during this period. Also, they also acquired a lot of skills because they were trained as well as they were medical volunteers as well as non-medical volunteers. Our focus was on non-medical volunteers, so they were given training on some of these aspects of in vaccination or whatever. So they really acquired some skills. Plus, it also influenced them as in terms of altering their future goals. Many of them who said that they wanted to work for corporate now want to work for the social sector, maybe for the government, for the health sector, or some of them want to still work for companies, but they want to work for those companies who are socially responsible, who are doing something for the society, not just making profits. So I think that is again another our finding in terms of how this volunteering experience influenced these volunteers. So in conclusion, I think this research has relevance for governments, because I think one of the things that you can see is that how Bahrain is a small country with just about 1.7 million people, but they were able to mobilize a large number of volunteers in a very short period of time. They have a volunteering platform which was existing before COVID, but during COVID, they were able to volunteer more than 30,000 volunteers, and most of them were women. So I think it is a great model for other countries, small or big, in terms of how they can actually mobilize volunteers who become very important in terms of dealing with situation, especially in crisis. It has relevance for companies because companies need to realize that when they are trying to attract this talent, younger generation talent, these generations are very social minded. It is very evident from this research also that they will like to work for companies who are socially responsible. So being socially responsible is just not good in terms of your CSR goals. It also is good in terms of your engagement goals, in terms of your talent goals. And also it has relevance for public and non-profits, because public and non-profits thrive on volunteering base. So they have tough time in attracting volunteers. And I think again, this understanding what motivates these volunteers could be very important in terms of how they attract more volunteers. Uh, the impact of this research, we have got a lot of media attention. Here in Bahrain, we have, as you can see, we have been covered by a very prominent English daily here. We have been covered here by a very prominent Arabic daily, and we have also been featured in a television interview. I can share all these links if you are interested. But it's not only the media attention and the public interest, it is also in terms of citations. Between this research was published in May 2022, so it is just about 7 or 8 months since this research has been published, and we have already got 7 citations for this paper, and it is growing very fast. And I get notifications on my ResearchGate app every day, almost every day, about either the number of reads going up for this research or the number of citations that is going up for this research. So that's very heartening. It's a very satisfying feeling for us, because we didn't do it to really project ourselves or promote ourselves. It was the real hero of this research or the story are the women in Bahrain. So we are happy that it has drawn attention of not only the people in this region, but of the different from different parts of the world. And of course, question and answers, and these are the links that I can share. I can share this presentation. It has all these links. Also, as a follow-up to this study, we have done another study which has also been published in the same journal, which is basically the motivation of volunteering during crisis, perspective of Polish youths during the Ukraine refugee crisis. We have done this because this is also a crisis situation, because about 6.8 million Ukraine refugees have crossed over to Poland, the highest to go to any country. And there are young Polish youths, male and female, young boys and girls, who are actually volunteering during this period, and we tried to study. Our finding is very interesting. We have also compared and contrasted this findings with the Bahrain study, because these are cultures are very different. When you look at Bahrain, it's an Islamic collectivist culture, but Poland is a mix of collectivist and individualistic culture with progressive leaning towards individualism. So it is very interesting how culture has shaped this. Maybe during if I get another opportunity later on, I can share the findings of this research, and also a comparison of how this research finding compares with the present study that I shared just now. Yeah, so that is all I have to say, and I will be very happy to take any question and answer questions that you might have, and I'll try to answer your questions. Thank you very much for this opportunity.
Thank you. That was amazing. And I was going to ask, well, my camera's not going to work. That's okay. I was going to ask if you had done any research that kind of compared country to country. So I'm happy to see that. I wonder what that would look like in the United States, given the diversity of religion and there's so many other things for youth to do that I don't think volunteerism may be as rewarded and in a religious sense and in a personal sense. So it
Yeah.
would be interesting to see that sort of study. What was your major takeaway? What was one thing that maybe surprised you about your research?
One thing that surprised me about the research was in terms of how the stories. I think that was the most surprising and element of this, is to hear with so much conviction, the women whom we interviewed, the conviction with which they shared these stories. Uh, I think that was really surprising as well as heartening at the same time. That was a big takeaway, and I think that shows that that kind of is also a myth buster in a way, because if you see, even although I come from the the eastern part of the world, still, I might have some misconceptions or myths about what this region is like. What is the role of women? Many times we feel that they are all veiled. They are confined to homes. They are not really doing anything except probably staying at home. This is a big myth, I think. Even women who are homemakers, again, they are many times looked second to those who go to work out. But this is a myth, because many of these volunteers were actually homemakers. They were not the ones who were actively working in the corporate world. So this is this is a myth buster in many ways. Number one, that women are like no one, nobody here. It is a myth buster. Women play a big role, significant role in this
Mhm.
country, and this part of the world. Number one. Number two, that homemakers can are not contributing in any way. Homemakers are contributing in home, at home. I think they are the ones who were most significant during this time. The unpaid volunteering that they do at home during the time when everybody's office, school, and everything became home, and the women at home were, no, they were like soldiers. They were fighting. They were actually serving everybody, taking care of everybody. And not only that, they were actually going out and volunteering. So the second myth buster, that women do not homemakers do not contribute, right? So I think these are some of the myth busters, and I think this is a big takeaway for us.
Wow, that is very interesting because it is a myth buster, and I think for across the world. Thank you. Others? other questions, you guys can unmute and ask any questions that you want to ask.
Yes, please.
Good afternoon, Dr. Sengupta. Good morning, Dr. Sengupta.
Good
How you
afternoon, Dr.
doing?
Tejas.
I
I'm
think you
doing
did a
good. Thank you.
phenomenal job. I just wanted to ask a question or actually go back to something you mentioned. I think you said that the women make up 49% of the working population. And
Yes.
so in that geographical location, if they're making up 49%, if we were to look at a different location, what do you think is the difference? Why is it that they're making up 49% here, but not as much in other areas? And then
Yeah,
what
I
would
think
be
the reason is how the government actually has taken very active steps here in Bahrain, led by His Majesty the King. I think they, in terms of how they have taken very active steps in terms of one, promoting the education, not only the school education, but the higher education of women, right? So there are enough opportunities for women to educate themselves, not only opportunities, but there is a lot of push, there is a lot of motivation to educate women, right? And this is one. Second, Bahrain, unlike many other countries, is going through a stage of, although it's still a masculine society, but it's in a state of what we call as fluid masculinity. The fluid masculinity is different from the traditional masculinity, so it's changing. The attitude of men in this country has changed, and it's changing, and it is becoming more welcoming, accommodating, and encouraging towards women. So this is number two. Number three, the job opportunities for women in both the government and private sector are there. Even, and especially in the government sector, their women are encouraged to seek employment and find employment, and also in the private sector. So I think this is the three aspects. And if you see, Bahrain has articulated a Vision 2030 economic plan, which also looks at creating not only employment opportunities but involving women in a big way. So I think it is primarily policy driven, and also to an extent the change in terms of what I said, the emergence of fluid masculinity. I think these are the two main factors why Bahrain boasts of 49% working population as women.
thank you.
Thank you. Others? Other questions? Well, if there are no other questions, I want to thank you so much for doing your presentation, and we look forward to hearing the next one. And I will certainly get you on the list for that one because we do want to hear that one as well. Um, that was really insightful, and I must say
Thank
I
you.
learned a lot. So I look forward to seeing more of your research. Thank you so much, and we will get this up on our YouTube channel so others may enjoy it as well. Thank you very much, Dr. Sengupta, and everyone else. Thank you for attending. Have a
Thank you.
great
Thank
day.
you.
Thank you very much.
Thank you.
Bye
Thank you. And
bye.
would you like me to mail the presentation to you?
Yes, yes. If you want to do that, I'll get it out to our group. Yes, that'd be
Yes,
awesome.
because it has the link.
Yes.
So if anybody wants to read the research, they will be able to do that.
Okay. Very good.
Oh,
Very
okay,
good.
okay,
Yes, I'll be
cool.
happy to share that. Thank you so much. Have a good
Thank
day.
you. Thank you.
Bye bye.
You too. Bye bye.